Okay, we're back. We're live. It's, gee whiz, it's Tuesday already, Tuesday at 2 o'clock. And the roles are reversed. This is Healthcare in Hawaii, except I'm Jay Fidel, and I'm the visiting host.
Yes.
And our regular host, Josh Green, Senator Josh Green from the State Senate, is here as my guest. And that's because we're going to do on this show, Healthcare in Hawaii, we're going to do a healthy review of 2015 with Josh. Lots of stuff has happened, you know.
Yes.
If you think of all the things that have happened in the newspaper in our world, you know, many of them, if not the plurality, even if the majority of them are in health, aren't they?
Yeah, healthcare legislation, major events, catastrophes, outbreaks, it affects all of us. And so as we age, we see the need to have better healthcare systems. It's everywhere. It's why it's so interesting policy issue, actually, and no one can ever escape it. It permeates the budgets of state government and federal governments, and any of us can get sick anytime. So I think it's the most important issue we've got.
Yeah. So are we in the same place as other states, Josh? I mean, I know that health is so important, and the Department of Health has 3,000 people working for it.
Yes.
Major State Department, with lots of functions, so many functions. It would take all day to describe all of them.
Right.
And my recollection from talking with other members, you know, of the State Health Department is that it has a great and long tradition in Hawaii to try to keep us healthy.
Yes.
And that part of that is out of the monarchy. Part of that is out of the notion that we're isolated and we really have to take care of ourselves. Are we better off, more interested in health than other states?
Well, first of all, you're suggesting we're not in a monarchy now, right?
So I'm only clear about that.
Okay, yes. So if we're not going to consider the Ige administration a monarchy, we will call them a democracy for today. They do run a good Department of Health in general. The state is in a better spot than almost every other state. A week or two ago, we got named the healthiest state in the country for the second year in a row at least, and we're always in the top 2 or 3. There are a lot of reasons for that. One, we have been committed to prevention for many years. We have some of the best, we'll probably touch on this, some of the best smoking legislation in the country, if not the best. We have an outdoor community. We're able to be outside and exercise more. Some people say that because we have a large Japanese population, that gives us a little advantage in some of the epidemiologic areas. But then, of course, we have some challenges with the Hawaiian population that really suffer and die younger, as we've talked about on our show.
Yes.
So, but yeah, we're the healthiest state. We do a lot of things really well. We do some things a little bit average, which we'll talk about. But for the most part, we're ahead of everybody, which means that we have the capacity to take on new challenges. We had the capacity this year, for instance, to pass legislation on tobacco. We made the legal limit to smoke 21 years.
It's a great thing.
First state in the country to do it, and the reason it's so important is once kids or adolescents become smokers, they often become smokers for life.
It is habit forming.
It's habit forming, it's totally addictive, and if you're 15 or 16, you have friends that are 18 and they could get people cigarettes. But now with the age being 21, the evidence seems to show that far fewer kids will start smoking. So lots of credit to Department of Health and Senators Baker and Rep. Bellotti and people that pushed that issue forward. It's big.
It's a great thing.
It's a big deal.
Great thing. I mean, you know, in the past, what is it, maybe 15 or 20 years, Hawaii has wedded itself off tobacco so well.
Yeah.
It started out in the downtown office buildings. You know, you can't smoke in the building, then you can't smoke outside the building. And people objected to that. You know, smokers have rights too,
Yeah.
But now we really have come of age. This is an important milestone bill as far as I'm concerned.
It is, and you know, you'll see that we'll even have a further separation as far as the health indicators from other states very quickly. It'll be almost impossible for us to be knocked off of our perch as the healthiest state in the country year over year as this, which has a bigger, as a doc I can tell you, has a bigger impact than almost anything else. So, you know, we had that huge success, and a lot of other people look at us as kind of the role model on smoking legislation. I even had a strange moment. I was at a national conference the other day, and the head of R.J. Reynolds, former R.J. Reynolds, came up to me and he kind of patted me in the back, and he said, "You've been a worthy adversary for these many years, and
thorn in our side,
and you beat us. You know, you beat us in Hawaii, and we don't mind so much in a weird way because they win in other states. I was in Tennessee when this guy said this to me, and they have a lot of tobacco there, but their wins are people's losses a lot of the time. And so I think it was an interesting moment, and it was telling. And I'm hoping that other states across the country take a cue from us and follow our lead.
Yeah, fabulous. Let's talk about other issues that have come up. For example, autism coverage. You had a bill on autism coverage. That was important because a lot of people were having trouble on a social level with autism coverage.
Thousands of families in the state of Hawaii have a child that's got autism. The number is 1 in 68 children born are on the autism spectrum. It used to be a higher number, it used to be 1 in 130, 140, but now that we've had more diagnostic support and people have been aware of it, the number has gotten more clear. What the cause of autism is, we don't know yet. Everyone's got a theory.
Does it affect some groups more than others?
It does. It affects young parents that live near industrial factories, near highways. They have a much higher risk. People think that's related to heavy metals and toxins in the air. So these are the worries, and that's why you see all this other legislation about pesticides and heavy metals. But from the perspective of a mom or a dad that has a child that's born with autism, they just want help. And so what the bill did or does is it guarantees that every family will get $30,000 a year of coverage for that important behavioral therapy. And what we found when we did our research was that if you have a child with autism and they get no help throughout their life, first of all, they have a very tough life.
Yeah.
Second, the family has a very tough life.
Yes.
And third, society pays $2 to $3 million in the lifetime in support of that child. If you have a child that gets the therapy from ages 3 to 13 or so, that number drops down to almost nothing. They need almost no state support. They can have a job, they can have a good life, they can integrate into society, and
society doesn't pay as big a bill for it.
Right, and their family, who loves them equally either way, has a much greater potential to have a more normalized relationship with that child. And so called that Luke's Law after Luke Pinau, who was there for the last 10 years as a little boy with his mom coming, beautiful guy, and he was an inspiration to us. And so the legislature does a lot of terrible stuff and ignores certain issues, and it drives me crazy and probably drives people out there crazy. But on occasion it does the right thing, and you've been nice enough to focus on two of the right things.
I think it's really important when you have this kind of, the autism bill is an intersection of the social aspect of it and the medical aspect of it, and you put the two together and we look good.
Yeah.
And on research, I attended, in fact, we filmed, in fact, is it playing now? It was playing last week, our OC16 show on Hawaii to Zero,
Yes.
AIDS, HIV/AIDS. There's a lot of research going on at the Cancer Center under Cecilia Shikuma and others, very sophisticated medical researchers over there.
Yes.
I mean, I don't think people realize how much quality research is being done. Hawaii is way out there now.
We bring a lot of resource into the state. Medical research, biomedical research is obviously an area where there's an incredible amount of activity, like for the reasons we talked about earlier, it affects all of us, but also I think if you take a step back and you look at the healthcare system, we spend $3 trillion a year. Now it's $3.2 trillion a year on healthcare in our country. And that ranges everything from vaccinations to Alzheimer's disease at the end of life. And in the middle, it could be HIV/AIDS or heart disease or goodness knows what. And that drives a whole nother industry, which is biomedical research. So places like Hawaii can become a center for research on HIV/AIDS, like you mentioned, or Alzheimer's disease. I think we got a big grant, and that was in the paper the other day, $1 million grant. It employs a lot of people, and there will be breakthroughs in our lifetime. In the next 20 to 30 years, many cancers will be cured. Certainly many cancers will be diagnosed much more effectively early in life and therefore treated effectively. And some of these other diseases will be preventable, and that's the key. So if we can support the Cancer Research Center, I mean, I'm a big supporter of it, there's no question. We use tobacco monies, once again, the tobacco tax increase in 2006.
Perfect,
yeah. So that's driven a lot of money there, but there has been some pushback, and a lot of people, even at the Capitol, and it really kind of gets my back up when people say we shouldn't support things like the Cancer Research Center, because when you say that, you're almost admitting defeat on, number one, the ability to work on these huge problems in society, and two, some of the very best jobs and the very best reasons to come to Hawaii often are housed at JABSOM or the Cancer Research Center or Queens, places where we have a brain drain a lot of the time from Hawaii. And I would say, though I absolutely love the hotel industry, and I think it's to come to Paradise is in many ways as therapeutic as many of the medical treatments we come up with at the hospital where I work, I will say I don't want to see us not be encouraging that intellectual swath of society. And so I hope we have a solution to keep the cancer center open.
Wouldn't it be wonderful if we could solve some of the questions in cancer and HIV/AIDS and other diseases that haven't been cured yet? And if we can do that here, it makes us look like a medical center. We are a laboratory, diversity laboratory anyway.
Right.
But if we could look like a health center, then people will come and we'll have another dimension to tourism that will be, well, I say, healthy.
Yes, it is. And we've had some success. We've had, I'll tell you, we've had some people that came to the state of Hawaii. We had Dr. Butler, who won the Nobel Prize in 2011 for his work in immunology. He came and lectured for 2 weeks, and a couple of us are trying to encourage him to come and be part of an institute here in the state of Hawaii, maybe a private-public partnership. There's lots of possibilities. People, they both dream about coming to Hawaii and making that part of their life, especially the latter half of mid-career, where they think, okay, they're going to build something, and maybe why not do it in Hawaii, East, West, and so on. And also, it is a little bit more predictable. You can't just pick up and go to Asia or Southeast Asia and start an institute and not be sure that it's not going to get overrun if there's a government turnover or
some issue, yeah.
Right. So we need to encourage Hawaii to be a center of activity, and because it's such a huge economic driver, it makes a lot of sense.
Yeah, and we can incentivize it. We should incentivize it.
I think so.
But at the same time, we have the doctor drain, if you will.
Right.
Which is, that's painful in the sense that what it converts so easily, and Obamacare is involved in this somehow also.
It is.
It converts to, I have to wait for more time before I can get to see my doctor.
Right.
And it's that simple now. You can say, well, so what? Wait. But wait like everybody else. But, sometimes at the margin of it, some people are going to, have health issues because they couldn't get in to see the doctor.
It's a huge problem. This weekend, 2 days ago, I was on call. A young individual was playing with another kid, and they dropped a high-powered pellet rifle, and it shot the 10-year-old in the tibia, the shin bone here, and that bullet was lodged into his bone, and they got him to the ER very quickly, and I was there, and we took care of him. And it was a pure miracle I got a surgical consult. I would say only 1 chance out of 5 do I ever get a surgical consult on the neighbor island right away. And can you imagine if your child was shot, if it had been anywhere but into the bone, if it had been into a major blood vessel like the femoral artery, that child probably would have died, or I might have had to amputate his leg. So I felt both lucky for the child, but also it's not acceptable to have a roll of the dice whether or not we have access to care. And that's why this issue keeps coming up, and I'll of course keep covering it on our shows. We have to put a reasonable model of incentives and enticements to come to the state of Hawaii. It tends to be the lowest reimbursements, and that's fine, but in that case we have to make sure that there's the lowest overhead and lowest administrative burden, so doctors are willing to come back, practice, stay in the state. There are many, many ways we can attract them, but we also discourage them simultaneously. And so our healthcare provider shortage, which has been like this as a line, kind of flattened.
The shortage goes up.
It's been going up because our population is older, and in some cases...
Sure, the bell curve, yeah.
So we've been just barely keeping up with it, and if we catch any bad breaks or healthcare reform on the federal level disadvantages us in some way, we could fall off of that curve, and then you could see real problems.
And you can't fix a problem like this overnight. It takes time to draw them in, keep them here, and all that.
For sure.
Just a comment, I think it's great to have a practicing physician in the legislature.
Thanks.
How can you possibly address these things, with due regard for the vagaries of medical practice and medicine in general, unless you are a doctor? A non-doctor just doesn't have the same level of information.
Thanks. Yeah, I see it every day. I'm going back on call tomorrow morning. And so I don't know what will come through the doors, but it does usually inform what I try to do at the legislature.
Yeah, really important that we have that, because I think we can be the state of health, and we have to work at it, but I think we can achieve a global reputation over time. Yeah.
Thanks.
So what about dengue fever? You've talked about that. You've had some pretty hot discussions in 2015 about that. Let's talk about it.
So dengue fever broke loose on the Big Island on September 11th, of all dates, of the last year. That's when the first cases started popping up, but the Department of Health didn't become aware for any number of reasons for 40 days. I guess there wasn't thorough reporting. Probably some docs should have done a better job, and the labs probably as well. But by the time they got wrapped their lasso around it, there had been several dozen cases, mostly in South Kona and further south, wrapping around the island. And once dengue gets out, you have to kind of hope against hope that it will fizzle, because there are not a lot of good ways to respond. I was angry that we didn't bring the CDC over immediately. I kind of wanted to see a force from the National Reserve to be deployed and provide more information. We went back and forth a little bit about that, but it does appear to be fizzling now after about 200 cases.
What's the status of the vaccine? I understood, is it Cardax?
Yes.
Working on a vaccine, and somebody wants to buy Cardax or wants to buy the vaccine. One of the nationals, yeah.
It would be great. You know, the CDC director of vector control, Dr. Peterson, told us there are 5 different groups working on a vaccine. CDC is included, Cardax is another, and there will be a vaccine. He said very clearly, and very intelligent guy, that's the only way you're going to stop dengue fever internationally. That right now, people need to realize that though it's been really rough for us on the Big Island and maybe even other parts of the state to worry about dengue, of the 7 or 8 billion people in the world, a full 10% are, a full half of them are exposed in a region, and a full 10% of those individuals get it. So 300 some million every year get dengue fever. It doesn't kill very many people, but it sure makes it for a terrible sickness. And we're not used to that. Also, there are other mosquito-borne infections that we have to really worry about. I think Dr. Park especially Dr. Park and also Dr. Presley spoke very intelligently about that. Zika and Chikungunya. I mean, I was sitting there yelling at them here and vice versa, but they were right about that. Zika is an outbreak of a similar virus in Brazil, and that virus is a bummer because if a woman is pregnant and she gets Zika virus, it's now been shown that they believe it causes microcephaly, or small brain development, decreased brain development, small heads in babies. Terrible tragedy. Yes. So these things have long-term consequences. So really, this has been a test run for us. Can we deal with an infectious disease outbreak well in the state of Hawaii? What do we have to do better? They're learning a lot of lessons the hard way, I suppose, but it's been a very valuable process, and thank goodness not too many people have become sick, but I feel terrible that we were unable to keep it just to a couple dozen people and that the outbreak continued.
Well, it goes back to medical research again, and to listen to Cecilia Shikuma about how you stamp out a virus, and to hear some of the lecturers on that day 2 weeks ago talk about how viruses are so hard to eradicate.
They are.
It's really hard. It's the great challenge of medicine now. If we could figure it out right here in Honolulu, they would beat a path to
it would be great to have a virology institute here. We now see that we could be a very effective center of research because Southeast Asia, all the tropics, not only do they send individuals here with these viruses from time to time, but we have the capacity to quickly get over there and do field research. My personal prediction as a statewide leader, but just an individual as a doc, is that it's not going to be a war that does us in. It's going to be an infectious disease that creates the largest challenge in this next generation. So don't expect it to be World War III taking out 2 billion people. Expect it to be a pandemic of influenza or a pandemic of some other virus.
Some mutation we haven't seen before.
A mutation of a very robust virus like dengue that gets worse, very unfortunately, through a bad series of mutations and then doesn't get beaten out. That kind of thing where you have several billion people, like I described for dengue, exposed, that could kill many, many millions, and it could wreak havoc on economies and on governments. So that's what we have to be prepared for in the next half century.
Okay, and we're going to be prepared for a break in the next minute.
Good.
So we're going to have a short break. That's Josh Green, Senator Josh Green. We're talking about a healthy review of 2015. We'll be right back.
Aloha, my name is Justina Spiritu, and I'm the co-host of Hawaii Farmers Series. This is my co-host, Matthew Johnson, and you can catch us every Thursday at 4 p.m. at thinktechhawaii.com. What do we talk about, Matt?
So on Hawaii Farmers Series, we're going to be bringing on the farmers and also supporter of farmers. including restaurants, caterers, as well as government supporters and nonprofits to hear their background stories and understanding our local ag community just a little bit better.
Yeah, essentially, there's a lot more that goes into farming and the local food community beyond just producing the food. And we want to feature and get the background story on all these folks and see how we all work together as a community. So join us every Thursday. Aloha.
Okay, we're back. We're live. We're here with Senator Josh Green talking about a healthy review of 2015. Ooh, iambic pentameter. Okay, the other disease that has always fascinated me, I mean, but on a scary level, is the Rat Lungworm virus, is it?
Yeah.
Which exists, well, it has presented itself in the Big Island.
Yeah.
And a few years ago, that was pretty scary. I don't know how scary it is today, but you mentioned before the show that you are contemplating some legislation over that.
Yeah, it's for technical purposes. Yeah, it's not a technically a virus. It's a parasite, and this, but it's an infectious disease. You're correct, and so people have been picking up this parasite on vegetables, mostly from the soil, if they're not cleaned well. And there's been a cluster of cases again on the Big Island. It's wild over in my hometown, my home stomping grounds, and it's very difficult to diagnose. People come in, I can tell you as an ER doc, come into the ER all the time with headaches. And sometimes you do a CAT scan, sometimes you don't, sometimes you give medicine, sometimes you don't. But that's one of the presenting causes of severe headache. And once it gets into the neurologic system and those worms essentially die, they can kill you. And we understand.
It's grotesque, actually.
Yeah, and the Department of Health has had a difficult time getting ahead of that one. And I know that they've also had some people reach out to them. I think that in Hilo, there's a department there that works on parasites and epidemiology, and they would like to spend some resources fully surveying where the cases have been, educating the physician community and the citizen community about the risks, because this is a disease that you can completely avoid if you know to always clean your lettuce, always clean your vegetables. If you have any high risk, present to your doctor early and just get a simple pill that kills parasites, you're fine. If it gets into the nervous system, you're in deep trouble.
Yeah. And I think the distinction point is that you can stop it at any individual.
Yes.
So if everyone washes vegetables, none of that organic to the point of leaving the soil on the vegetable.
Right.
Then we don't have it anymore. It goes away.
Exactly. And it's a question of people being aware. Like if I can harken back to our discussion about dengue, right? Well, there were a lot of people coming into the hospitals with fevers and headaches in the early part of the flu season, and no one was testing for dengue because we weren't aware that there was a cluster. As soon as you were aware there's a cluster, we started testing people and we saw that it was an outbreak, had to engage, educate, mobilize.
Yeah.
Rat lungworm, same kind of thing. The only problem with rat lungworm is it's actually killed a bunch of people. Dengue, thank goodness, hasn't killed anybody because we haven't had the variant of hemorrhagic dengue fever or toxic shock dengue fever, thank goodness. But some people say that maybe we should be spending all this energy on rat lungworm. And I think that this operation that the Department of Health has undergone and this idea that they only had 2 vector control individuals because of cuts, which is terrible, and I think we're all been responsible for seeing some of those cuts go on. They need to beef up and be allowed to beef up their team so they can work on dengue, rat lungworm, influenza outbreaks. We prepared for Ebola. It never came, but we were prepared just in case when it was a big outbreak.
You were on a panel about that a few months ago, yeah.
We were on a panel and we had a lot of great activity, and Toby Claremont and Dr. Park and all these individuals, our past director of health, who was just wonderful, Loretta Fuddy, I think she had a doctorate. We mobilized in the right way and people were super educated, but that was because it was so clearly fatal. No one was going to mess around.
And highly contagious.
So these are all different infections, but we as a state, because we're right in this travel nexus between the rest of the world, we have to be ready. So whether we have an institute of research or whether we have a full complement of healthcare providers and epidemiologists, we can't afford not to be ready.
A part of that might be a laboratory. I don't know if you remember Dwayne Goobler.
I don't.
He was one of the Cadman recruits early on.
Cool.
Brought him in from the National Institutes of Health. and he's infectious diseases, and he wanted to establish a laboratory there, just in the close of the medical school.
Right.
And it was going to be an expensive laboratory, and Gubler had raised something close to $50 million.
Wow.
David McLean was then the UH, and it was the medical school was part of the Manoa campus, so McLean controlled it. Well, he would have controlled it anyway, I guess, and he killed the project. Not clear because they had the money. They could, and Dwayne Gubler left town. He disappeared, a great asset to us. Yeah. And right now, aside from the Waimanu Home Laboratory, up there on the hill, we don't really have an infectious disease laboratory. And I wonder how important that is going forward. Should we be focusing on it? Should we be trying to get Gubler or somebody else back to do an infectious disease laboratory?
It will help us. The reality is it's been a 7 or 8 day turnaround on dengue fever testing, which is an awful long time in the life of a doctor or a patient, I'll tell you. So we would like to have that. We do have a lot of capacity here, and now it's of course easier than it used to be to fly lab specimens over to the CDC in Atlanta and whatnot. But if we were ever overwhelmed with a large outbreak, it's going to be one heck of a challenge to bring in a lab emergently. So if someone wants to invest in a lab, if I were in a position as the president of the university or as the governor, I would encourage it immediately. We have the need, and as we've seen with outbreaks this year, we can justify it. So this won't be the last outbreak of a serious infectious disease. I can tell you that for sure.
Yeah. So that would make it safer for us.
Yes.
The other technical question that comes to mind is that, if you have a doctor shortage, technology can help in terms of communication.
Yes.
And for that matter, it can help in terms of patient care,
yes.
Even across the street. If I can get on the internet, call my doctor, and have a conversation, yes. Not in person. At even an appointed hour, but not in person, so I have to travel.
Right.
This is especially useful in the outer islands. So
yeah.
Is that in the cards?
It is. In fact, I was meeting with the heads of HMSA today in my capacity as a medical director. We were going to roll out a pilot in early 2016, and it's going to be activated for the entire state in 2017. They're changing the way they're going to pay for healthcare. In other words, they're going to pay physician providers, nurse practitioners, PAs, the PCPs. They're going to pay them based on having a panel of patients. No longer is it going to be based on just churning people through the system, which means that one of the rules that they explained to me this morning, it's interesting you asked today, is that one of those commitments is going to be that the providers, the docs, can communicate at least a couple times a year directly with patients, whether it's through text messaging or emailing or what have you. The problem used to be on telehealth that doctors didn't want to do it because they were already busy, already had their schedule filled up completely to the gills. And then if you added things that weren't reimbursed or weren't protected from a medical record standpoint or a privacy standpoint, they just wouldn't do it. It was too much risk and so on. Well, HMSA in their new plan has very intelligently removed that issue. That barrier's out completely. So a provider, a doc, let's say they've got 2,000 patients, they'll receive a certain amount of money to take care and do their best to make sure all those people stay well. And it may very well be, like I haven't seen a doctor personally in years. I can self-treat for a few things here and there, but, but I do have a designated, God knows who, primary care provider, right? I just never see them. But for them to be able to communicate with me very quickly on some basic question makes all the difference. And now the healthcare system will be able to provide those services without the worry of having to fill in every last little second of their schedule. It's a very smart move. It's the direction that we will go as a state, and it will also mean people have additional access, whether it's to dietitians or people that could be in public health. A lot of these individuals will become part of the healthcare system through these things like, you got your iPhone there, I got mine in the bag, we have iPads, we have all these devices. The new generation takes in healthcare differently, and I think the system here in Hawaii is poised to be right-fitted. And this may be the very solution that has eluded us on the healthcare shortage. Maybe we've been looking at it wrong for some time. Maybe the idea that getting a lot of extra bodies here isn't the only solution. That instead, lightening up on some of the technical, I would say almost archaic approaches to mandatory seeing your doctor every 6 weeks for follow-up, this, that, and the other thing, may not be necessary when we've got good technology to take care of it. So a doctor may be have twice the capacity if you make him or her, better equipped to help take care of people. And I think that's what we're going to see in 2016. My organization, in that case, the Hawaii IPA, we're going to be leaders on this in partnership with HMSA. And I think patients are going to see their access improve real greatly. I still want docs to come and go to med school here and train. I want the young ones to take over my shifts at the hospital, believe me. But I think that the system is going to look totally different 10 years from now than it does today, and probably for the better.
Visionary.
It's pretty much.
Visionary. We are certainly ahead. And I think inherent in what you were saying is the notion of kind of collaborative diagnosis, collaborative decision process.
Yes.
You know, I tell you, I've done some reading, you know.
Yes.
I can read, and I go to the internet, and I have some possible differentials I'd like to run by you, doctor.
Yeah.
And you can comment yes, no, or I'm out of my mind. But we can have a conversation which actually brings me in. I think you get a better result that way.
Yes.
And in any event, the patient feels more committed to the process.
Well, I told you about that kid that had the bullet wound. His mother came in. She was, a very beautiful person, a little scruffy coming in she's a cowgirl, had boots on, and they had come off of a horse back riding session. And the first thing she was aware of was pain management, certain medications that could be used, and certain risks that she was worried about, which was like a compartment syndrome, which I won't get into now, but it's fairly sophisticated knowledge from a really just good person that you might not have, if you were being judgmental, expected to be so well informed. And she was terrifically informed. And so, look, I hadn't seen a gunshot wound in several years. I didn't mind so much having some of my experiences and memories triggered by a nice young mom whose kid had been shot in the leg. So it's a different world.
You think there'll be more of this?
There will be more informed individuals. And I can tell you that's going to also be very important because we've historically, as Americans, not had the greatest health literacy until recently. And that has meant that people sometimes utilize the healthcare system inefficiently, coming into the hospital for minor colds and flus and this and that, which really doctors can't help with much, but we can help with a whole lot of other things. We need to change the system a little bit, and people have to drive that. It's really not likely going to be the doctors in the trenches changing it. It's going to have to come from kind of a people's movement. And this is an opportunity. We have opportunities in Hawaii because we have so few insurers, and we're contained completely and isolated completely, that when we do a program, we can all quickly be informed about it, we can all do it together, and that makes us unique. Then if other states, like I traveled to Utah recently and Nashville recently to share with them what we're doing, they can choose the things that might fit them, and we can learn from them as well. But a lot of people, I think, are taking their cues from us in some good ways, and that's kind of neat.
I'm having an emotional reaction.
See?
This is great.
Yeah.
This is visionary. It's a bright spot on all of Hawaii is what it is.
Yeah, well, there are good moments here too, Well,
let's have a good moment in the way of a break.
Yes.
Okay, that's Senator Josh Green. A healthy review of 2015. We'll be right back.
Hi, I'm Ethan Allen, host of Likeable Science on Think Tech Hawaii. Come join us every Friday at 2 p.m. when I interview interesting scientists about what they do, why they do it, and why we should all care about it. It's a lot of fun to see. And you can learn interesting stuff. You'll hear all kinds of fascinating science, and we know you'll have a great time. Hope to see you then. Bye-bye.
Hi, my name is Sachiko Slomov. I'm the floor manager of Think Tech Hawaii here. You can join us on the air every weekday from 1 to 5, or off the air at thinktechhawaii.com. We stream all of our videos and all of our amazing shows at thinktechhawaii.com or on our Ustream channel. You can also check us out on Twitter at thinktechhi or Instagram at thinktechhi also. I'll be listening, and I hope to see you there. Thanks.
We're back. We're live with Senator Josh Green, a healthy review of 2015. And we did get a tweet here. Thanks for a great show, Josh and Jay. Can we expect any news of Climavax? That's CLIMAVAX, Cuba's lung cancer vaccine coming to Hawaii. What do you know?
Well, I don't know anything specific, and I do appreciate the tweet about that particular treatment, but that's exactly the reason that we need the cancer center or a cancer center in the state of Hawaii, because to get people into advanced clinical trials from other nations, from other states, the only way you can really do that effectively is to have a designated institute. For doctors to do it in kind of one-off, like a doc like me running a small practice, or if I had a series of patients, and as I have over the years with lung cancer in this case, it would be impossible for me to have the infrastructure to organize a trial or a series of treatments. So you have to have that. It's one of the fundamental reasons I get so upset when people talk about shutting down a good program like the Cancer Center. We have to have it. I don't know, I'm sorry, anything specific about this, except that I will say cancer therapies are evolving very quickly. So what we're seeing is people using the already basic human immune system. We're kind of moderating it, so to speak. And so when we make a small change to it, we can enable our own immune system to attack an antibody through a monoclonal antibody. Or
Read about that, yeah.
That kind of thing. You can directly attack tumors. You can expect treatments that before were completely ineffective, or just chemotherapy kills all cells, which disabled people terribly, throwing up, totally weak. Sometimes they kill you. These other more targeted treatments, like I believe this one, will make all the difference in the world to many, many millions of people. And that's one of the very exciting things. And I got 2 little kids, right? I expect Maya and Sam, if God forbid they ever get sick with cancer, to be able to get cured. Whereas you or IGA, we're probably finished, right? Because some of these treatments are just not there yet. And life has always been that way. If you look back 50 or 70 years ago, before we had antibiotics, a simple
Infection, and it was the end of you.
Yeah, I had a blown appendix. I would have been dead at age 9, right?
Yeah.
Except we were lucky we had penicillins and some other early antibiotics. And so my ruptured appendix was treated surgically, and then I got antibiotics for a week, and I lived. But I certainly would not have lived had I been born in 1950 with that same problem, or 45. So, you know, it's a really amazing world we live in. Hawaii has the capacity to lead and to attract extraordinary people and extraordinary educators and researchers, and we have also the capacity to grow them ourselves here. But we have to be committed to higher education, and we have to be committed to emerging economic models. It can't just be mainstay tourism and paradise. It has to be other things if we expect
We
to
have
be
to
leaders.
be part of the medical research, medical technology community.
We do.
And moving so fast, the only way we can really stay in touch with it, you know, the front end.
Yeah, and look, we can communicate through our show and through, you know, these amazing small devices with world-class researchers and people doing studies on that cancer vaccine that viewer mentioned. Mm-hmm. We can communicate instantaneously, but there is something to be said for having a stable laboratory or having a stable institution in one state, because you have to have some, you know, you kind of have to have the bricks and mortar occasionally, and you have to have some quiet, calm moments where you collaborate in person. A lot of the best thinking that people do is by having
Just
that
like
conversation.
this.
Yeah. So I think it's necessary, and we'll keep encouraging it. We've had now a president come from the state of Hawaii, even if it's peripherally. We've had some wonderful thinkers come and go, and I'm encouraged when I see young people. There are a lot of really brilliant young people out there, but get them good public education. We have to make sure that they're not, you know, one of the 2,000 or 3,000 homeless children right now might have an IQ of 170,
Right.
And we don't want to miss out on
Entirely
that.
possible.
Yeah.
Let's talk about the Maui State Hospital.
Yes.
This was a fabulous maneuver. This was one of the best things that ever happened in Hawaii. It will not only change healthcare, in my opinion,
Yes.
But it could change the way, you know, unions deal with government, deal with private industry. It's a watershed possibility, isn't it?
It is a definite huge change, and I think it was necessary to explore a different approach. We had kind of languished without changing any of our major hospital institutions for a long, long time, and Maui Memorial was going under. I mean, there were lots of red ink, and the state, in times of trouble, didn't have enough resources to keep that facility open without great hardship to the people. So we approved a partnership model. I already have seen the union stepping up, and it's my understanding that they're going to consider doing a private union on Maui. It looks like it'll be partnership. It's been approved with Kaiser. They, I'm sure, will work with all of the providers on Maui. It's interesting, you know, I think that this is going to be the test case for the rest of the system to see if it works. If it doesn't work, we have other options, but they may not be as good. One is to bite the bullet and really fund healthcare completely, which is a challenge with this many people struggling.
Costs a lot of money.
Costs a lot of money. Remember, 1 in 4 people in the state of Hawaii are on Medicaid, and that's, God bless them, they're having a hard time economically, but that means their health care gets covered by the state, you and I, and whoever's paying taxes. So it's a very big challenge, and so that's hard to come up with that much money. Or if you don't want to do that, you have to change the scope of services. And as a neighbor island senator, I can tell you there will be a revolution if we're told on the Big Island or on Molokai or Lanai or Kauai, in addition to Maui, that we're only going to provide basic healthcare services. Man, people are not going to tolerate that, because when your loved one is sick, you won't accept that you can't get surgery, or you can't get an important C-section, or you have to go live on Oahu because you've got cancer. That's not going to be okay. So we have to solve this problem, and in the next 18 months, we're going to see whether Maui can solve its problem with this new economic model. There will definitely be legislation.
Privatization.
Yeah, it's
and Kaiser Permanente is actually running the Maui Memorial Hospital now.
Yes, so as soon as they wrap up their final contractual dealings with the governor's office, they'll run it, and they'll do contracts with everybody. They have, of course, a sugar daddy in Kaiser in California on the mainland, but Hawaii Pacific Health is also wealthy. The Adventist guys that run Castle, the Seventh-day Adventists, they are poised to partner with Hilo. Queens has been enticed now to partner with Kona. So I think, particularly once
It's great.
Yeah.
Everybody's cooperating. What's happening here?
I don't know. Maybe it's the marijuana in our society that's getting people more cooperative. But the truth is, I don't think Art is smoking a lot of marijuana or the leaders at Kaiser. I think really Marianne, I think what they're seeing is the institutions that have done well have to step up, and the unions who are critical partners in this also have to evolve with the system, and that's what we're seeing really in real time right now.
Also enlightened. But you mentioned marijuana. We don't have a lot of time left, but let's talk about marijuana. That certainly was a major bill, medical marijuana.
Yes.
Obviously on the road to recreational marijuana. Where are we? There was something in the paper, a little disagreement going on about the rules promulgated by the Department of Health. Where are we?
So we created a statute that will allow dispensaries in the state. They'll open up in 2016. Starting next week, people can start bidding. I really hope it's on the up and up. I always have been worried about other people trying to influence our system, but it's good for patients. It's good to have dispensaries. The rules, they're going to work through those rules. I know that some of my colleagues were pretty enraged with the Department of Health, and the Department of Health pushed back. God bless them. I'm glad they do. That I think that what has to happen is society has to decide, as long as we can be safe for young people, where we are on the kind of libertarian front on people's use of drugs that aren't, number one, not particularly addictive, marijuana isn't, and don't seem to have the same consequences as heroin or cocaine or methamphetamine. So the country's liberalizing on this issue. It can be done relatively safely. I'll tell you this, as a physician, I'd rather see people use medical marijuana than be on OxyContin or Codone or hydrocodone. So there is a trade-off there. It has to be done safely. So we're in the test bed phase of dispensaries, but I think it's probably safe to say that this is somewhere on the spectrum toward decrim or legalization, probably over the course of 3 to 5 years. The feds have some work to do on how that's going to happen. We're leading the way with about 8 to 10 other states. I just tell people, look, be careful with your teens. Don't let them smoke pot. It does affect their development. Beyond that, I believe people should have certain privacy rights. If it helps people with their chronic pain or it helps people with their severe chronic illness, good.
You know, it's all these things taken together. We have finished the list, but we have finished our time.
Yes.
It just strikes me where we are in an age of enlightenment here in Hawaii in healthcare. And it's fabulous, and you're at the center of it. Congratulations. I admire your work.
Thanks. You're too nice, Jay, but I enjoy doing it, and I'm going to keep doing it for a while. And we have a lot of capacity here in our state. So we get leaders come and go through Hawaii, but as a state, we'll lead on healthcare.
let's take 1 minute more, Josh, if you wouldn't mind looking at camera 2, and tell them what kind of experience you've had with ThinkTech and the show Healthcare in Hawaii this year.
Well, I've enjoyed it. Being a host on healthcare, on ThinkTech for Healthcare in Hawaii as my program, it gives me an opportunity to explore any number of issues. I've had all the health leaders in our state come talk with us, and I think that over time people will realize this is an extraordinary asset in the state. It's difficult for people to break out of their daily toil, but if an expert, if I can describe myself as one, both clinically and in a health policy moment, can help bring other thinkers to the fore, it's just great. And I think you have a lot of programs that do that. We've deconstructed the way the media works in many ways. It's just so nice to see a lot more people be engaged. So I'm going to keep doing these shows, and if you're out there and you have a certain area of expertise or interest, call us and consider doing a program. Reach out to our excellent producers and hosts and sponsors, because we want more and more involvement and more expertise in Hawaii.
Thank you, Josh. Thank you for a whole year. Congratulations on the award you received from ThinkTech at our Christmas gathering. That's Senator Josh Green. A healthy review of 2015, the age of health enlightenment in Hawaii. Thank you so much.
Thank you.